You're listening to the HNC Let's Talk podcast, hosted by Dexter Brooks. Thanks for tuning in to HNC Let's Talk podcast. We partner with subject matter experts to provide candid conversations on health and lifestyle. Here at HNC Let's Talk podcast, mental, physical, spiritual, financial, and health are all connected. This episode of HNC Let's Talk podcast is sponsored by Health Net Co. Together, we make insurance simple.
Good afternoon. This is Dexter Brooks with Health Net Co. Insurance Agency. How is everyone doing? It's been a while since we actually touched base, but I did want to reach out to everyone and give an update. As everyone knows, on March 11, President Biden signed the American Rescue Plan Act of 2021, which is named the ARP, into law. And I know most people have been basically going over and looking at waiting for that tax subsidy, that tax credit, that $1,400 that I understand. However, there's more in this plan than just that particular tax amount, okay? So for those did you know that under this new plan, this plan actually affects Obamacare? It's a big change in the Obamacare. The new law that was put into place will lower premiums for most people who currently have a marketplace health plan and expand access to financial assistance for more consumers. Also, under the new law, many people who buy their own health insurance directly through the marketplace will become eligible to receive increased tax credits to reduce their premiums. So now I know on the federal marketplace, starting April 1st, consumers enrolling in the marketplace coverage will be able to take advantage of these increased savings and lower costs. Also, premiums after these new savings will decrease on average by $50 per person per month, or by $85 per policy per month. 4 out of 5 enrollees will be able to find a plan for $10 or less per month after premium tax credits, and over 50% will be able to find a silver plan for $10 or less. Now, you must remember the marketplace is a little bit confusing. We do have the federal, we do have the state marketplaces. I'm headquartered in Colorado, so Colorado uses healthcare.gov. They're still actually going through the process on trying to determine when is the best time to roll this out. So all brokers are now still communicating with them, and we will let everyone know in Colorado as soon as we hear something on the Colorado side of the house. For states that are on the federal marketplace, it will start on April 1st. Also, you have to realize the other situation here is that under the federal, if you enroll and you want to receive these lower premiums, it's up to you as a consumer to contact a broker like myself. Our number is 833-444-4139. And you can reach us, and you have to go back in to the system to resubmit your enrollment in order to receive these savings. Now, these are tremendous savings, the lower cost and the expanded access under the American Rescue Plan. Now, thing also, individuals and families may be eligible for a temporary increase in premium tax credit for this year, with no one paying more than 8.5% of their household income towards the cost of the benchmark plan or less expensive plan. So with that being said, that means under the federal side of the house, even if you came back in, you would be able to change plans and go with a lower plan, okay? Because you not necessarily have to go with the silver plan or the benchmark plan. You may decide to go with a lower cost and pay zero. So that basically meaning many consumers will be eligible for a higher tax credit amount to help cover their marketplace health plan premiums. This new lower cap on the percentage of a family's household income that goes toward premium addresses this, what we call the subsidy cliff for those household incomes above 400 of the federal poverty level. Because before this law was signed, people who were earning $56,000 or more would receive zero tax credit. Now those people will see savings. So if you have possibly enrolled or earned higher than $56,000 annual year, I would advise you to go back or contact us to get enrolled into the marketplace so you can save some money. Okay. One other important thing on this is just really, really important, and that is people who receive unemployment, at least 1 week of unemployment, are now able to enroll into the marketplace and receive a tax credit. Another big key point to this plan is that people who lost their job, decided to, and was on COBRA or could not afford COBRA. This new ARP, American Rescue Plan Act of 2021, will cover that COBRA expense as well. This is extremely huge. So when you think about everything that's going on with the $1,400 plus the savings in your medical expenses, Americans are looking at a huge change for the first time in over 10 years. So we're going to start back and just make some key points here. There's been a lot of questions on this. So let's go and see what we can answer. So some of the questions we had was, when will the extra tax credit be available on the federal side? All right. Increased premium tax credit based on the lower income contribution percentage, along with expanding tax credit access to consumers' household incomes above 400, will be available on the federal marketplace starting April 1st. This means that new consumers and current enrollees who submit an application and select the plan on or after 1st will receive the increased premium tax credit for 2021. Marketplace coverage. Extra tax credits for consumers receiving unemployment compensation will be available starting this summer. Make sure you have that this summer, okay? Another question we received. I'm currently enrolled in a marketplace plan. How do I receive the additional tax credit to lower my premium? So current enrollees, including those who recently enrolled through the 2021 Special Enrollment Period, can update their application and enrollment in order to get new eligibility results starting April 1st. So you will need to reselect your current plan in order for the changes to take effect to reduce your premiums for the remainder of the year. Now, while the 2021 Special Enrollment Period opportunity is available through May 15th, current enrollers can decide during this SEP opportunity if they may want to change to a new plan for the rest of the year. Now, you should also consider how much you have already paid towards your deductible when deciding whether or not a change in plan makes sense for you. So when you change plan, the amount you paid already towards meeting your prior plan's deductible may be reset to zero. And you would need to start overpaying out-of-pocket expenses to reach the deductible on your new plan. I want to repeat that again so people do understand. So if you decide to change your plan on the federal marketplace, you should consider how much you have already paid towards your deductible. And when deciding whether or not to change to a new plan, You need to make sure, because what's going to happen is possibility is your deductible will reset back to zero. So then you have to start that deductible all over again. So this is why it's so important to come back, speak with the broker, contact us at 833-444-4139. We can access your information through the federal marketplace and assist you with those changes. Okay, so that is very, 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 very important. Let's see here. Now, here's another question. If you live in a state that operates its own marketplace, okay, that's what we're talking about, the state-based, okay? What should you do? As I stated, state-based in Colorado is actually currently, as of this week, looking into this, trying to figure out what is the best options for Coloradans. So, and we will keep you posted and up to date on that. I do believe I did hear, and we have to check with the state. California will start on April 1st. I'm not quite sure about New York. I will research that and get back with you on that. So, but as for the federal marketplace, it begins April 1st. Okay. Next question. I'm currently enrolled through the marketplace. What would happen if I don't come back in? That's a good question. Consumers who enrolled in the marketplace plans prior to April 1st have the choice of waiting until they file their taxes next year in 2022 to receive the additional premium tax credit amount when they file and reconcile their 2021 taxes. However, we recommend all enrollees come in, update the application, and review their plan options during the 2021 Special Enrollment Period through May 15th, because you may be able to choose a plan with a lower out-of-pocket cost for the same price or less than what you're currently paying. And that's another great key point. Even though you can reconcile your taxes at the end of the year, we advise you to come back in and select a different plan, because you may be able to save more money. Next question. If I don't have coverage, when should I apply? That is a great one. Consumers who need coverage starting April 1st should still apply and select a plan by the end of March through the Special Enrollment Period, so coverage can start April 1st. Then to get added benefits, you can come back after April 1st, submit your application again, and reselect your plan to have increased tax credits applied to your coverage from May 1st moving forward. Perfect. See, now that's so important, because you can still go ahead and apply today. Come back. Now, most people say, well, that's a lot of work. I got to come back. That's what we as brokers are here for, to assist you. Get in touch with us. Go ahead and apply now. Come back in. Most brokers like yourself, we'll reach back out to you and say, hey, you need to reapply again. So make sure you get another notification. You need to reapply again. Next question. If I am already paying a very low premium or no premium, should I take any action? Another great question. Consumers who are already paying low or no premiums may find plans with more generous cost sharing and lower out-of-pocket costs and benefits from changing plans. Premiums after tax credits will decrease on an average by $50 per person per month. 4 out of the 5 enrollees will be able to find a plan for $10 or less per month with the new premium tax credit. And over 50% will be able to find a silver plan for $10 or less with the tax credit, meaning you may be able to find plans with lower out-of-pocket expenses and lower deductibles for a similar premium to what you are currently paying. So basically, yes, come back in, shop. Already paying low premium, come back in and shop. Always important. Next question. If I'm receiving unemployment compensation, should I wait to apply? You should apply and select a plan by the end of March in order to enroll in coverage starting April 1st. After April 1st, you can come back and to update your application, confirm your current plan with the updated tax credit. Later this year, you may be able to receive another increase in premium tax credit available to you, which is a great question. We will have more information available this summer once these additional savings are available for consumers who have received unemployment compensation during 2021. At this time, you can come back to the federal marketplace to update your application and current application with more tax credit to reduce your premiums for the remainder of the year. Next question, last question. Will the marketplace automatically update premium tax credits on behalf of current enrollments? Now, this is on the federal side. If consumers don't take any action, they'll still receive the additional benefits as part of their premium tax credit when filing their federal income tax return next year. Okay? So beginning on April 1st, consumers must come back to the marketplace to update their application in order to receive the increased tax credits this year. However, we are also exploring whether tax credits can be updated on behalf of consumers during 2021. So it's not a yes, not a no. It's just that there's still a lot of questions that haven't been answered. So still waiting on those. So again, the American Rescue Plan and the marketplace. It is huge. It is extremely huge. Again, if you have any questions, need any assistance with this, reach out to us at fnetco.com or contact us at 833-444-4139. I have not, it's been over 10 years since premiums in the marketplace have been slow. And again, I'm Dexter Brooks with HealthNet Co. Have a great weekend and